We have a problem, and you can help. I'm an emergency doctor working in a busy emergency department, and day after day I see the department full of patients that are admitted to the hospital, but they don't have a bed upstairs, and they sit in the ER waiting to get the care they need for hour after hour and sometimes day after day. We need to get those patients upstairs. Their health depends on it.
All the studies have shown, and this is resounding throughout all the literature, that the number one and most significant factor in what's called emergency department crowding is the lack of inpatient beds. And what happens is, when people need to be admitted, there's no inpatient bed for them to go to. So, where do they stay? They stay in the emergency department. Somebody 10, 20 years ago decided, hey, that's the best place for them to stay.
I was there for the better part of 2 days on the very uncomfortable gurney in the emergency room.
Bottom line is, for emergency department crowding, is your needs are greater than resources. You have met a point where the department is unable to meet all the demands of all the patients in the department.
Everybody's noticed how long it takes to see a doctor in the emergency department. When emergency department beds are full of admitted patients, there's no room to see new people, so they just sit and wait.
Emergency department boarding is a problem for everyone. It affects wealthy people, it affects poor people, it affects people who have the best insurance out there, and it affects people who don't have insurance. It happens in community hospitals, it happens in fancy private hospitals, and it even happens in county hospitals.
When the emergency department is overcrowded, it goes on diversion and stops accepting ambulances. That means if you call 911, you may not get to go to your hospital. You may not see your doctor, and your ambulance may just keep on going, looking for an open hospital.
And what happens to that patient in that rig? Well, they have to bypass 1, 2, 3, 4 hospitals just to get this to find one that's open. Meanwhile, the patient in that rig needing emergency services isn't getting it.
The statistics are staggering. Did you know that if you come into a crowded emergency department with a heart attack, you are twice as likely to have a serious complication? Did you know that if you're admitted to the hospital and you spend a long time in the emergency department, your mortality is going to be 30% higher? On top of which, if you spend a long time in the emergency department, your length of stay in the hospital is going to be 1 extra day longer. Which of course means that while you're in a hospital bed, someone else is waiting downstairs in the emergency department for your bed. We need to get our patients upstairs.
Studies show increased risk of morbidity and mortality because a patient showed up in the emergency department on a day they were crowded.
It can be difficult as well when you're taking care of patients that have been there for a longer period of time, and then your new patients are coming in, to share your attention in an appropriate way. The patients that have just arrived, we don't know what's wrong with them yet. Whether or not it may be life-threatening, we're not necessarily sure as soon as they hit the door. So it's important that they get attention immediately. And that can make it difficult to take care of the longer term patients, where you have your plan of care, what you plan to do at what times to meet their needs.
My biggest concerns as a director of an emergency department that is a medium-sized department is that patients are not receiving as high a quality care as I would like to provide. I'm concerned that patients are lingering in the emergency department long after the decision to admit them into the hospital has been made. And during that time, they receive care that could be improved upon if they were in a more quiet setting, not in the hallway of an emergency department. They could receive better nurse care if there were nurses dedicated to them, not nurses that are in the emergency department assigned to them, but who are busy with other critically ill patients that continue to arrive, but nurses that can provide them with even more personal one-on-one or direct care. That healing is influenced by your environment.
But it was very cold. And I was feeling terrible anyway, so was shaking, and with the cold was shaking even more.
Well, we had one gentleman that was drunk and he was snoring very loudly. There was another person who was slowly but surely passing away.
It's not possible to really rest at all. You know, there's so much going on. Other people in who are sick, who are hurt, whatever their problem happens to be.
We're emergency doctors. We're highly trained specialists in the art of acute emergency care. Nothing's more important to us than giving our patients the care they need. And what we need to do is treat them acutely and then get them to the specialists that take care of them for the long term.
Political leaders need to know this. This is one of the few problems in medicine that you can solve tomorrow. All you need to do is make it possible for hospitals to adopt the ability to use their capacity, physical capacity, as maximally as they can. At some point, in some days, the hospital will literally be full. And that's all that we can do, is take care of the patients that we can fit into the hospital. But for now, we fit the patients into the one place in the hospital, the life raft, if you will, the one place in the hospital that must be open all the time by federal law to every person who walks in. And it will remain open, and we will take care of those patients. But legislators, politicians, community leaders, this is one place where you can plug a hole in the dam of American healthcare with a simple law. Make it possible for us to take care of patients upstairs. After you do that, the competitive marketplace will help that. That'll take care of itself. No hospital will want to be the one who's left behind.
And we've never been black.
Since you started it.
We were on...
Doctors at LA County, USC are doing just this. It's called the surge plan. When their ED is crowded, they spread admitted patients throughout the hospital, and hallways upstairs if they have to. The effect has been dramatic. Emergency department waiting time has gone down. Boarding time has gone down. Hospital length of stay has gone down. And look at the drop in the percent of time the ED is overcrowded. It's a relative drop of 81%. All of this leads to improved patient care. With all you've seen today, I hope you feel that we can come together as a united front, ease discomfort, and save lives.